So peripheral arterial disease, at its most basic, is blockages of the blood vessels that are outside of the heart. So anywhere from the top of the head down to the toes. And for most people here, it's usually affecting the legs. That's most common. For many people walking around, they may be asymptomatic or not have symptoms for many years up until they do. And so lower extremity or leg peripheral arterial disease runs in a spectrum from, subtle, small, annoying things up to limb-threatening conditions that require urgent management. So there's a broad range of presentations for peripheral arterial disease. The risk factors for peripheral arterial disease are the same as they would be for cardiac disease. Things like hypertension, high cholesterol, history of smoking, history of diabetes. Usually these 4 things play a large role in the development of peripheral arterial disease because vascular disease is a systemic disease. It affects both the heart and the rest of the vessels. So the same things that increase your risk of heart attacks also increase your risk of peripheral arterial disease. Some of the symptoms of lower extremity peripheral arterial disease include claudication or cramping in your legs, typically in your calves when you walk, that is relieved by rest. But this can progress up to pain at rest or developing non-healing wounds that continue to cause problems. There's no one specific test that can tell me everything I need to know about someone's vascular disease. However, physical exam is very important with diagnosing peripheral arterial disease. We also use non-invasive tests like blood pressure measurements in the ankles, as well as ultrasounds or more advanced imaging such as CT scans or formal angiograms. If left untreated, peripheral arterial disease can progress to limb threat and potentially loss of significant function in your daily life. The sooner we can see you and get you in, the more options available to treat you early on. The good news is there are so many treatments available now that no matter what you come with, there's something we can offer for you.